afternoon. I am State Representative Jonathan Steinberg, co-chair of the Public Health Committee, Representative Westport. We're here today with my co-chair, Senator Anwar, and our ranking members and the entire committee to JF some bills. We have 6 bills on today's agenda. And just to be clear, we will be holding the vote open. Depending upon when we get out, we'll figure that out. I will turn it over to my co-chair, Senator Anwar, for any opening remarks.
Thank you, Mr. Co-chair. Looking forward to voting for these bills, good bills, and I have having bandwidth issues, so I'll keep my camera off for now. Thank you so much.
Thank you for letting us know. Good morning, good afternoon, Representative Pettit.
Thank you, Mr. Chairman. Short agenda. Thank you very much for that. And as we discuss, we'll likely be able to allow half of these to go out on consent. And let's get started, sir. Thank you.
Thank you. Yes, it's unusual for us to have a short agenda. It's ruining our reputation for doing everything the long and hard way. So we'll see how we go. I do not see either of our Senate rankings yet. Maybe they're going to be joining us shortly, or we'll be voting remotely later on. So without further ado, why don't we jump in with item 1 on today's agenda, Senate Bill 213, an act allowing medical assistance to administer vaccines. This is a JFS to the floor. Is there a motion?
So second.
Moved by
Senator Anwar.
By Representative Foster. This is a bill which we are very familiar with. We have tried to get this passed many times. The JFS language does take into account the ability for APRNs and PAs who have the appropriate relationship, the supervisory collaborative agreement to supervise the MAs in the administration of vaccines. I will just highlight for those who are not aware that the MAs are required to take significant training in vaccines, both education and clinical experience. So they should be well prepared. And it's also at the discretion of the supervising practitioner whether or not to grant to MAs in a specific instance the ability to administer vaccines. Do we have comments or questions? Seeing none, I understand this is one of the, there's Representative Terziak jumping in at the 11th hour. Here we go.
Thank you. Jeez, let's go. Thank you very much. Sorry about that. You mentioned they have extensive education or training in vaccines or vaccine administration, and they have extensive training and extensive education, but nowhere is it required that it include administering vaccinations. And certainly there is no minimum amount of time set aside for either learning how to give a vaccination or about vaccinations. And it, by the way, easily fixed before when it reaches the floor. Choose how many minutes or hours. Thank you. All done.
Thank you, Representative. Of course, we're open-minded to having further discussions after the bill passes out of committee, such that we can get it right and assure its passage on the floor of both chambers. Other comments or questions? If not, Madam Administrator, I believe we're ready for a roll call vote.
Motion to
Senators, I missed that. What was that?
I'm not sure if you're, Mr. Chair, I wanted to see if we can start a consent calendar. A motion to.
Yes, we can. I understand that there are those who want to register their vote in the negative on this bill, so we will not do it for this bill. We will have a roll call. If that's okay. All right. Please proceed, Madam Administrator.
Representative Steinberg.
Representative Steinberg votes yes.
Senator Anwar.
Senator Anwar votes yes.
Senator Kushner. Representative Gilchrist. Senator Wong. Senator Summers, Representative Pettit,
Representative Pettit votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger-Givallo,
Representative Berger-Givallo votes yes.
Representative Betts, Representative Carpino,
Sorry, Senator House.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Toffany votes no.
Representative D'Amico, Representative Elliott, Representative Foster,
Representative Foster votes yes.
Representative Django, Representative Green,
Representative Green votes yes.
Senator Haskell, Representative Cavers DeGraw,
Cavros DeGraw votes yes.
Representative Kennedy,
Representative Kennedy votes yes.
Representative Clarides Detrier, Representative Lenahan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan, Representative Scanlon,
Representative Ryan votes yes.
Representative Tersiak,
Representative Tersiak votes no.
Representative Young,
Representative Young votes yes.
Representative Zupkis, Senator Kushner, Representative Gilchrist, Senator Wong, Senator Summers,
I apologize. Could you give me the bill number? I'm coming late from another meeting.
Senate Bill 213, the first bill on the agenda.
Heather Summers votes yes.
Thank you. Representative Betts, Representative Carpino, Representative Elliott,
Rep. Elliott votes yes.
Rep. Jenga, Senator Haskell, Representative Scanlon, Representative Zupkis.
Thank you,
Thank you,
Madam
Mr. Chair.
Secretary. We will be holding votes open till 4 p.m. There seem to be a number of our members who are in transit, so hopefully that will be sufficient. Moving to item 2 on today's agenda, House Bill 5190, an act concerning testing for the human immunodeficiency virus. This is a JF to the floor. Is there a motion?
So moved.
Moved by Representative Foster,
Second.
seconded by Representative Berger-Givallo. This is a bill that requires PAs, APRNs, and physicians who treat patients 13 years or over to offer the patient an HIV test at least annually where practicable, which we'll have to figure out what that means. The individual can decline the test. And we've asked the hospitals and primary care physicians PAs and APRNs to develop protocols for implementing the HIV testing requirement, and DPH needs to get back to us by January of next year with after consulting with community-based organizations to develop educational materials for the public. And then those materials need to be posted on DPH's website. This is intended to ideally identify those who may have HIV and be unaware, not be symptomatic at this point. We are concerned we don't know what we don't know, and there may be people out there who could be on a therapeutic regimen. Representative Pettit.
Thank you, Mr. Chairman. I'm going to have to vote no on this bill, and for these reasons. I think the intent is quite admirable, and you outlined that if we pick up people who are asymptomatic and offer early treatment. The stats from the Department of Public Health's website for 2020 showed 174 cases reported to DPH. This bill is another example of attempting to legislate medical practice, if you will, and we had fairly strong testimony from a number of emergency room physicians and primary care physicians, as well as the medical societies, noting that although the intent is good, that to ask the question is short and quick. The typical visit is somewhere between 12 and 15 minutes. In the best of all worlds, the discussion that ensues often is much longer. Most physicians in practice typically know their patients, assess the risk, and make a determination about what tests may be required, including HIV testing. I realize for the emergency room, it says that if there's a life-threatening emergency or someone cannot consent, it's not an issue, but it mandates, jumps into the patient physician relationship, mandates things that physicians have to do that I think people are doing in a good fashion. And I think we should opt for more education. And for those reasons, I can't support the bill in current form. Thank you, Mr. Chairman.
Thank you, Representative, and thank you for highlighting the importance of education, which is a component of this bill. And I take your point that we ask a lot of physicians and APRNs and PAs in the very limited time they have to interact with patients. But I would argue that if it is identified as a problem, that longer conversation really ought to take place. That's what good medicine is about. So I'm hoping that they would find a way to have that extended conversation should that become an issue. Senator Summers.
Yes, I wanted to just make my comments and align them with what we had heard from Representative Pettit. I have reached out. We've heard the testimony from the medical society, from some of the high-ranking physicians that see many patients. This is something that can happen every day if a doctor has the relationship and finds that their patient is at risk. But to mandate this at specific intervals and specific, appointments, I think is overreaching, and that, that should be left to the patient and to the doctor who is trained in how to look for risk factors, et cetera. We have so many mandates on physicians and APRNs. They should be able to work within their scope of practice and make that medical decision as to, who requires, high risk patient, and they're the ones that should make this determination, not a legislature telling them what to do as far as, what tests and how they have to ask for things. I do think education is the way to go, as Dr. Pettit had, Representative Pettit had stated. And I will remind people that a physician's time is really limited on some level as far as everything they have to get through by the insurance companies. They want a physician to see a patient every 15 minutes. So I agree, if a physician had a high-risk patient and they had a conversation about needing this test, there would clearly be a longer conversation about the risk factors, how to improve their lifestyle, perhaps, how to seek medication and treatment, et cetera. But to mandate this for everyone and on the schools, I think is too much, and I will not be able to support this bill as it's written. Thank you.
Well, thank you, Senator. If there are ways that we could improve the bill, presuming it passes out of committee, I'd be glad to discuss that with you. Representative Berger-Travallo.
Thank you, Mr. Chair. I would definitely agree with the good representative and Senator that education is critical, but I would just like to share from a slightly different perspective that in practices that are larger, and to highlight that limited time that Senator Summers mentioned as well, 15 minutes is not enough for most doctors to get to know who their patients are and to recognize whether or not they are at risk. I know that I have bumped into my own primary care doctor in specifically the rice aisle of the Whole Foods yesterday, and she had no idea who I was, just coincidentally. So I would definitely say that we need to remember that most physicians do not have the opportunity to get to know their patients as well as we would like.
Thank you, Representative, for highlighting an ongoing pressing problem for all of us is the managed care has wrought some damage on the relationships that used to exist between practitioners and patients, and it's something that we bemoan its loss and seek to find ways in which we can encourage more effective dialogue. And this bill does not solve that problem, nor does it solve it for any number of the other issues that might present during a very brief period. Just getting a patient's history these days is hard to do in that time frame, particularly if the physician is spending his time looking at a tablet versus at the patient directly. We have some broad issues in delivering care here in America. Senator Anwar.
Thank you, Mr. Chair. I think this bill highlights some aspects that are worthy to discuss. One of them is that HIV is become a chronic illness, and it is also a preventable illness. And early identification can change the course of the illness. And if we do this right, this bill in a few years would become irrelevant. And I think that's what the intention is, to try and get ahead of this illness and identify the people, the actual base of the ones who are silently infected and are at a risk of infecting others. And once we are able to get a better handle on that situation, we would be in a position to literally overcome the deeper impact of HIV in our society. So I think that's the value of this bill. I respect Senator Summers and Representative Pettit's perspective. I think if we were to look at it, that if we do this right in 5 years' time, this bill may not even be needed. But we need to get all the asymptomatic people and identify strategies for the spread of and prevent that spread further. But thank you so much, and I will be supporting this bill.
Thank you for that, Senator. Any other comments or questions? I would simply urge that if you have some qualms about this bill, that we get it out of committee and be glad to discuss them further. Seeing no further questions, I understand there are those who intend to vote no, so we will do a roll call vote, Madam Administrator.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner, Representative Gilchrist, Senator Wong, Senator Summers,
Hold on. I'm sorry, Senator Summers votes no.
Representative Pettit,
Representative Pettit votes no.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger-Givallo,
Representative Berger-Givallo votes yes.
Representative Betts,
Representative Betts votes no.
Representative Carpino, Representative Cook, Representative Dauphiné,
Representative Dauphiné votes no.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Representative Elliott votes yes.
Representative Foster,
Representative Foster votes yes.
Representative Django, Representative Green,
Representative Green votes no.
That's me.
Senator Haskell,
Senator Haskell votes yes.
Representative Cavros DeGraw,
Cavros DeGraw votes yes.
Representative Kennedy,
Kennedy votes no.
Representative Clarides Dechair, Representative Lenahan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes no.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Tersiak,
Representative Tersiak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis, Senator Kushner, Representative Gilchrist, Senator Wong, Representative Carpino, Representative Cook, Representative Django, Representative Scanlon. Thank you, Mr. Chair.
Try it again with sound. I have been advised that a number of our colleagues are traveling this afternoon and have been asked to extend the vote until 5 p.m. If there are no objections, we'll extend it till 5 so everybody has an opportunity. Seeing no objections, we will move to item 3 on today's agenda, House Bill 5275, an act prohibiting certain health carriers from requiring step therapy for prescription drugs used to treat mental or behavioral health conditions. This is a
So moved.
Second.
by Representative Terziak before I even get it out of my mouth. And do we have a second?
Second.
Second.
By Representative Foster. This bill prohibits individual and group insurance policies from requiring the use of step therapy for drugs prescribed to treat covered individuals with mental or behavioral health conditions, providing the drugs comply with approved FDA indications. The objective of this bill is to help patients have better outcomes by getting them on the right therapy as quickly as possible, versus the step method, which is well-intentioned to control costs and to put patients in connection with the most common drug therapies for their condition. But there are some expressed concerns that that may mean postponing their getting to the right medication, which could have an impact on their general health and outcomes. Representative Pettit.
Thank you, Mr. Chair. I think I'm going to vote to move this bill forward out of committee. I think the intentions are admirable. Having dealt with this in my practice, sometimes the issue of step therapy sometimes is quite frustrating in dealing with the process that adjudicates that. Having said that, if this moves out of committee, I think, like most of the things we deal with, it's likely far more complicated than we think, and this will probably impact in a positive way only 1 out of 9, 1 out of 10 citizens in the state of Connecticut, given the way insurance is done in the state, and has the potential to increase cost. So though I will vote to move it forward, I think if it gets out of committee, we need to be aware of the possible ramifications, and the proverbial devil in the details. Thank you, Mr. Chair.
Thank you, Representative Pettit. Yes, most of the issues we deal with here are more complicated than they may seem initially. Are there other comments or questions? Seeing none, I understand some plan to vote in the negative, so we will once again vote via roll. Whenever you're ready, Madam Administrator.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner, Representative Gilchrist, Senator Wong, Senator Summers,
Senator Summers votes yes.
Representative Pettit,
Representative Pettit votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger-Givallo, Representative Betts,
Representative Betts votes yes. I know.
Representative Carpino, Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes no.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Representative Elliott votes yes.
Representative Foster,
Rep. Foster votes yes.
Representative Django, Representative Green,
Representative Green votes yes.
Senator Haskell,
Senator Haskell votes yes.
Representative Cavros DeGraw,
Representative Cavros DeGraw votes yes.
Representative Kennedy,
Representative Kennedy votes no.
Representative Clarice D. Representative Linehan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Tersiak,
Representative Tersiak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Would you just please tell me which one we're on?
House Bill 5275, item number 3 on the agenda.
Thank you. Representative Zupkis votes yes.
Thank you. Senator Kushner, Representative Gilchrist, Senator Wong, Representative Berger-Givallo,
Representative Berger-Givallo votes yes.
I did not see you on screen, please.
Representative Berger-Givallo votes yes.
Thank you. Representative Carpino, Representative Django,
Representative Jenga votes yes. Was I heard?
yes, sir.
Thank you.
Thank you. Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. Again, we will hold the votes open till 5 p.m. today. We will now move on to item 4 on today's agenda, House Bill 5278, an act prohibiting an unauthorized intimate examination on a patient who is under deep sedation or anesthesia or unconscious. This is a JF. Do I have a motion?
So move, Senator Anwar.
Moved by Senator Anwar. Yeah, you got one in. Do we have a
Thank you.
second?
Seconded.
Seconded by Representative Berger Giovanni. All right, some of you may be familiar with this bill under a different name that we've discussed in the past. It was previously referred to as pelvic examinations, but let me get into the specifics. This bill prohibits a healthcare provider from performing an intimate examination on a patient who is unconscious, under deep sedation, or anesthesia, unless the patient signs off with written informed consent and performing the exam is within the scope of the patient's surgical procedure or diagnostic exam, and is, in the case of an unconscious patient, is required for diagnostic purposes. The bill requires written consent forms that healthcare providers must give to the patients to sign, to say, among other things, that the form contains consent for examination of pelvic, prostate, or rectal region. And it also requires DPH to investigate any alleged violation of the bill's requirements and allows the department to take disciplinary actions if a violation is committed. The goal is to make sure that anybody who is put in that circumstance has actively consented for that kind of examination. And we're hoping that with the passage of this bill, this will cease to happen in the state of Connecticut. Are there comments or questions? Representative Pettit.
Mr. Chair, I wonder if you could just make a few comments on the informed consent vis-a-vis medical trainees, if that will require further amendment, or you think that the bill will be able to go straight through without further amendment? Thank you, sir.
Thank you, Representative, for bringing it up. That is something that came up in the context of some of the testimony we heard. I understand there are ongoing conversations taking place currently. I believe the Hospital Association and a couple of the bigger hospitals are involved. They're the ones who are most likely to want to make sure we get the language right. I see a representative of CHA here, and I know that he is dedicated to assuring that the language, by the time it actually reaches the floor of either chamber, is ready to go. So if we want to have those conversations, there is still ample time after we pass the bill out of committee.
Mr. Chair, could we start a consent calendar with this bill, sir?
If you insist, unless there are any objections. Seeing no objections, we will add it to the consent calendar. I was presuming there are no further comments. If that is indeed correct, we can move to item 5 on the agenda. This is House Bill 5396, an act increasing access to mental health education. JF, do I have a motion? Moved by Representative, you have to say that out loud, Representative Pettit.
So moved.
And do we have a second?
Second.
Seconded by Representative Berger Giovanni. I see your hands up, Representative McCarty. Was that to second, or I'm not quite sure what purpose? Okay. Let me get into this a little bit. The bill establishes a psychedelic assisted therapy pilot program within the Department of Mental Health and Addiction Services to provide qualified patients, and we'll talk about that in a minute, with funding needed to receive MDMA assisted or psilocybin assisted therapy as part of an FDA approved expanded access program. The pilot program ends when the federal DEA approves MDMA and psilocybin for medical use. We should say when and if, but we're presuming when. The bill also establishes a qualified patients for approved treatment sites fund, the PAT, not point after touchdown, but patients for approved treatment by DEMAS. The fund will provide grants to qualified applicants to provide MDMA assisted or psilocybin assisted therapy to qualified patients under the pilot program. And there are rules as to how that's going to happen. And additionally, the bill establishes an 11-member Connecticut Psychedelic Treatment Advisory Board within DEMAS to advise the department on regulations and infrastructure needed to safely allow therapeutic access to psychedelic-assisted therapy on the legalization of MDMA, psilocybin, and other psychedelics. It requires the Department of Consumer Protection to adopt a controlled substances schedule that DEA designates for MDMA and psilocybin, if so approved. and reclassifies the schedule and appropriates $3 million in general funds to Demas for deposit in the newly created PAT fund. I see a number of questions and comments. We'll start with Representative Pettit, followed by Representative Elliott.
Thank you, Mr. Chair. This is one of the more interesting bills we've raised over a number of years. PCP and other compounds have been fabulously successful in a small number of people with severe PTSD and other severe mental illnesses that have been refractory to other therapies, and certainly it needs to be explored. If I could ask you one question and then have a comment based on that question. Do you think, Mr. Chairman, that we addressed the Demas Commissioner's concern, all of this bill, and I guess I guess I'll make the statement. The Demas Commissioner said that the bill contained premature provisions related to complex psilocybin program that state agencies are not resourced to implement, and that they're not positioned to assist with the implementation. Do you think the language currently will allow us to move this forward, given the Commissioner's concerns, or that we'll need further work to make this successful?
Thank you for the question. It is indeed apt. We are treading on some new ground here. We'll be among the first number of states to try to help people. I thought we heard a tremendous amount of moving testimony, particularly from veterans, that this could be a game changer for them, having tried any number of other therapies for PTSD and other stress-related conditions, and not just veterans, others as well. So we're going to work really hard. We have a meeting scheduled with the agency for next week. We want to be able to make sure that the language addresses their capabilities. This is, in some ways, a bold bill. We're really trying to, move it forward in a consequential way. But we are very sensitive to their concerns, and we'll discuss it with them further.
I thank you for that answer, Mr. Chairman, and believe there's very exciting potential here, and hope that we can work through the vagaries of implementation, funding, staff, and being able to work through the state, federal kind of issues that will necessarily potentially intervene. Thank you, sir.
Thank you, Representative. Yeah, I agree. Sometimes we have to struggle with the feds. Sometimes we just wish they'd get out of our way, but that doesn't happen very often. Representative Elliott, followed by Representative Cook.
Thank you, Chairman. Just want to just express my gratitude for moving on this bill with the recognition that psychedelics are starting to be seen very seriously within the medical field as being exceptionally helpful for, as you said, PTSD, addiction, trauma, a whole host of psychological events and issues. And psilocybin is in phase 2 trials, MDMA is in phase 3 trials, and anything that we can do to continue this forward with the recognition that the FDA will continue doing their work doesn't mean we shouldn't be doing ours. So thank you. Good bill, ought to pass.
Thank you, Representative Elliott. Yes, we hope a lot more research gets done. Representative Cook.
Thank you, Representative Steinberg. I just wanted to thank everybody for listening intently and understanding the compassionate testimony that we had the other day from so many folks. And I think that by sitting back and not doing something, as we heard the other day, is costing lives day after day after day. And what an incredible group of folks that came to share their stories. And I hope that others have read all of the testimony for the people that had signed on but just couldn't get to our hearing. At the end of the day, we are here to make some tough choices. We might not always agree with the feds, but we need to do what's right. And I believe that this is a step forward in doing what's right. And I just want to thank everybody who's worked on this, their hard work, their dedication. And I welcome the conversations with the department, because if this is something that they feel they can't get behind, then we need to figure out another mechanism. But doing nothing, I think, would be criminal in this regard. So thank you all for raising it. And I thank everybody who will support this moving forward. Thank you, Mr. Chairman.
Thank you, Representative Cook. Representative Kennedy, followed by Representative Linehan.
Thank you, Mr. Chairman, and thank you for the opportunity to speak with us. I sat on the working group that put a lot of work into this through numerous doctors, physicians, psychologists, et cetera, from Yale. It is some premature provisions, but as Representative Cook stated, who also sat on the committee, the testimony that we heard was compelling. It was compassionate, it was emotional, and we owe something to our, especially our veterans who have served our country and many others that may benefit from this treatment. So I look forward to supporting this going forward. And thank you for your opportunity to speak, Mr. Chairman.
Thank you, Representative. Representative Linehan, followed by Representative McCarty.
Thank you very much, Mr. Chair. I too want to thank you all for working on this bill so diligently and moving it forward. I do just want to make the one comment that as we continue this discussion and moving this forward, that we start to think about adding in other treatments that maybe aren't necessarily talked about today, including ketamine. And we know that ketamine has been an important part of treatment-resistant depression. There are ongoing studies, and I believe that Yale is even doing a study on the use of intranasal ketamine for the treatment of depression in adolescents and the youth. So dependent on the results of that study, I think it's going to be important that we look into that as well. So thank you very much, Mr. Chairman.
Thank you, Representative, and I count on you to keep us abreast of the advances in research so we all develop a comfort level with both the efficacy and safety of such products.
I absolutely will. Thank you.
Representative McCarty.
Yeah, thank you very much, Mr. Chair. And just very quickly, I wanted to also add my comments to my support of this proposal. I was very impressed by the testimony that we heard the other day, and particularly impressed to hear that so many people who are suffering with severe depression and have been resistant to other types of medication and therapy have actually come off of medication. So I think long-term this has very high potential. Just wondered quickly if we have and I didn't see it in the language, do we know the amount of individuals that might be in the pilot program?
Good question, Representative. I don't have an answer at my fingertips on that. Obviously, the pilot program will probably also be limited by the funding, but I don't have a correlation between the resources we're making report.
Thank you, Mr. No, thank you very much. And then just finally, it's also just to be noted that NAMI is also supporting this proposal. Thank you.
Thank you for noting that. We have great regard for NAMI. I see Senator Summers has her hand raised.
Yes, thank you, Mr. Chair. I'd like to express my support for this bill. The testimony was very moving. There are many people that are resistant to therapies that we have now for depression and PTSD for people that are watching. This is a very controlled administration of a medication. Or a potential medication under controlled circumstances that really we heard from our veterans that have given their life for our country, how it has changed their life completely. Some of them have tried suicide multiple times, and this is the treatment that worked for them. I'm going to support this bill coming out of committee. I am concerned on the cost that has been associated with the potential pilot program. I think that that's something that we could potentially look at. It seems very high, and I'm concerned that the agencies have some reservations. So I hope that we can work through that to make sure that this is should this bill pass, a smooth relationship there. And I'm looking forward to see what the FDA does with this as it moves forward. Thank you.
Thank you, Senator. I'm sure we're all curious what the FDA is doing at any given time. Seeing that there seems to be general approbation, may I suggest that we add this to the consent calendar? Seeing no objections, it will be added to the consent calendar, which brings us to the last item on today's agenda, item number 6, which is House Bill 5419, an act concerning the Department of Mental Health and Addiction Services recommendations regarding regional behavioral health action organizations. This is a JF. Do I have a motion? Moved by Representative Pettit. I heard him. And I believe Representative McCarty is waving her hand, but you have to actually say something if you want to second it.
I'm so sorry. Yes, please second. I'll second. Thank you.
All right, we recognize Representative McCarty seconding it. This, to me, is an important bill because it seeks to redress some of the problems that resulted in 2018 when DEMIS reorganized the existing structure we had in the state of regional mental health boards and regional action councils, the RACs, replacing them with 5 regional behavioral health action organizations. This bill seeks to establish these 5 RBHAOs in statute, which we had not done previously, and repeals the laws that established the prior boards and councils, and requires each such RBHAO to serve as the strategic community partner responsible for behavioral health planning and education, coordination of prevention of behavioral health issues, promotion of behavioral health and advocacy for behavioral health needs and services within its mental health region. And I believe there are 5 of those, and it sets certain duties for these organizations. It also makes several corresponding statutory changes to effectuate the transfer of duties. And I think that pretty much covers it. This, to me, is an important bill because we've asked these new, fairly newly minted organizations, RBHAOs, to take on the extremely important task of dealing with prevention and working with a variety of organizations that have done yeoman's work in dealing with behavioral and mental health issues, addiction issues, and the like. They're also the ones who often have the assistance of people with lived experience as counselors and supporters. They're incredibly important organizations. My biggest concern remains that we continue to fund these organizations primarily through federal grants, and that they really deserve and require a dedicated and secure funding stream to do the good work they have. And in my opinion, could use a little bit more money than we're even prepared to give them at this point. But this is a good first step. Any comments or questions? See, Representative McCarty.
Yes, thank you very much, Mr. Chair. Very quickly, you stated it all very well. I think we need to put the regional behavioral health action organizations into statute outlining their function. But I particularly thank you, Chairman, for recognizing the value of their work in the community. We're putting more and more demands on these organizations. So I hope as we go forward, we can look to what resources we can offer to the regional behavioral health action organizations, because we know with all that's taking place with trauma, we're looking to do more with the schools. We have to keep an eye on how they're being funded and not just through the block grant. So thank you very much.
Thank you, Representative McCarty. Excellent points. Anybody who's paying attention to what's going on this session in the legislature recognizes that dealing with mental health issues is front and center for this legislature this year. We have bills such as House Bill 5001, Senate Bill 2, any number of others that are intended to redress many of the deficiencies in our healthcare safety net that have developed over many years and only became exacerbated during the pandemic. And if we are going to be successful, we're going to need these organizations to help us do so. Representative D'Amico.
Yeah. Thank you, Mr. Chair. I agree with you, and I agree with Representative McCarty that this is an important bill, and I would most likely support it. I would enthusiastically support it, but for the fact that there was testimony submitted in written form and also delivered in oral form at our public hearing on this bill, which I don't believe has been addressed at all since that time. Specifically, the people who testified referenced the fact that the catchment area councils, the CACs, are constituted differently than they were before the restructuring, to the extent or to the degree that, and I'll just quote one of the testifiers, the perspectives of people living with mental health and or addiction challenges and using the system designed to help them has been lost in the process. And we had a pretty extensive discussion about that during the public hearing, and here we are today. and there is no substitute language. Not one word of the bill has been changed since the hearing, which brought up this, what I consider to be a deficiency, or what certainly the people who testified considered to be a deficiency. And yet here we are ready to JF the bill. So I'm inclined to vote no, simply to flag it and to respect their concerns and to note their concerns, and maybe it will get someone's attention and that particular problem will be addressed and fixed. So that's the short way of saying I'm going to vote no to flag it for that reason. Thank you.
Thank you, Representative. I think most of us share your concern about what was lost when we combined these two different organizations. I will only say that we've had some conversations with the agency. Again, we're meeting with them on a variety of subjects in the near future to explore whether or not that within the means that they have been able to devote to this purpose, that we can address those concerns. You have my promise that we will discuss it in earnest and do it all within our power to see if we can redress that negative consequence of the merger that occurred 3 years ago. Any other questions or comments? Given that Representative D'Amico has indicated his demurral, we will do a roll call vote.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner, Representative Gilchrist, Senator Wong, Senator Summers,
Senator Summers votes yes.
Representative Pettit,
Representative Pettit votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Gervallo votes yes.
Representative Betts,
Representative Betts votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
thank you. Representative Dauphiné,
Representative Dauphiné votes yes.
Representative D'Amico,
Representative D'Amico votes no.
Representative Elliott,
Representative Elliott votes yes.
Representative Foster,
Representative Foster votes yes.
Representative Django,
Representative Jenga votes yes.
thank you. Representative Green,
Representative Green votes yes.
Senator Haskell, Representative Cavros DeGraw,
Cavros DeGraw votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Clarice Detrier, Representative Linehan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
I did not see you on screen, Representative Ryan.
Do you see me now?
Yes, sir.
Then I say I vote yes.
Thank you.
You're welcome.
Representative Scanlon, Representative Tersiak,
Representative Tersiak votes no.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Senator Kushner, Representative Gilchrist, Senator Wong, Senator Haskell, Representative Tardis Dechia, Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. Again, we're holding the votes open until 5 p.m. I believe we are now ready for the consent calendar, which is a little on the small side, including only items 4 and 5. If you're ready, Madam Administrator, we can begin with that.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner, Representative Gilchrist, Senator Wong, Senator Summers, Representative Pettit,
Representative Pettit votes yes.
Representative Arnone, Representative Berger-Givallo,
Representative Berger-Givallo votes yes.
Representative Betts,
Representative Betts votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook, Representative Dauphiné,
Representative Dauphiné votes yes.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Representative Elliott votes yes.
Representative Foster,
Representative Foster votes yes.
Representative Django.
Representative Jenga votes yes.
Thank you. Representative Green,
Representative Green votes yes.
Senator Haskell.
Senator Haskell votes yes.
I did not see you on screen,
I
Senator.
apologize, Madam Administrator. Senator Haskell votes yes.
Thank you. Representative Cavros DeGraw,
Cavros DeGraw votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Clarides Dechia, Representative Linehan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Kevin Ryan,
Representative Kevin Ryan votes yes.
Representative Scanlon, Representative Tersiak,
Representative Tersiak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Senator Kushner, Representative Gilchrist, Senator Wong, Senator Summers, Representative Arnone, Representative Cook,
Representative Cook votes yes from her son's track meet.
thank you. Representative Clarides Dechia, Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. One last time, we're keeping the votes open till 5 o'clock. Before we conclude or recess for today, I want to advise committee members and the public of our agenda for the coming week. On Monday, the 21st, we will have a public hearing. We have a large melange of stimulating bills to discuss. That will be via Zoom and YouTube. On Wednesday, the 23rd, we will be convening at 9 a.m. to continue JFing bills. In that, I know at least the House is in session that day. I will ask everybody to be ready to go right at 9 o'clock so that we have ample time to have a conversation about the bills that will be on that day's agenda. And we will have another committee meeting again at 12:30 on Friday, the 25th. Also, I want to make sure everybody's aware of the fact that we will have a special informational forum on Monday, the 28th, the following week, from 9 to 10:30 a.m. So we can hear directly from the CVH Whiting Task Force about their recommendations to this committee, which have informed the bill that we will have before us on the 28th when we do that day's public hearing, which will convene at 11 a.m. via Zoom on Monday, the 28th. Assuming there are no questions or concerns regarding our plans for the future, we stand recessed.
Madam Administrator,
Yes.
this is Henry Jenga. I believe I missed a couple of votes.
So did I, Madam Administrator.
I make 3.
4.
5.
I don't see her on here anyway.
Representative Django?
Yes.
Okay, you missed the vote on item number 1, Senate Bill 213. How would you like to vote?
Yes.
You missed the vote on item number 2, House Bill 5190. How would you like to vote?
Yes.
That's all I have for you.
Thank you, Madam Administrator.
You're welcome, sir.
Rep. Zupkis is here.
Representative Zupkis? You missed the vote on 2 bills, I think. Let me just double check and make sure. Item number 1 on the agenda, Senate Bill 213. How would you like to vote?
Yes.
Item number 2 on the agenda, House Bill 5190.
No.
Item number 6 on the agenda, or you voted on that one. There's one more I think you missed.
I believe I came in on item number 3, 5275, but I'm not sure.
Yes, you did. You did. Thank
So I'm
you.
all set. Thank you.
Who is next? Representative Carpina?
Yes, ma'am.
Item number 1 on the agenda, how would you like to vote?
No, please.
Item number 2 on the agenda, how would you like to vote?
Yes.
Item number 3, how would you like to vote?
Item number 3, still 5275, ma'am.
5275, yes, please.
I would like to vote yes.
I think that's all you missed.
I think so too. Thank you.
You're welcome.
Hi, Bev. I think I have one miss. It's Michelle. I voted. I just think that you missed that I didn't come up on the screen.
I think that is House Bill 5190.
Representative Cook is a yes.
Concerning testing for HIV.
Yep, that's fine.
How do you vote?
Representative Cook is a yes.
Thank you. Sorry about
I
that.
vote
Senator.
yes. Thank
Yes,
you.
ma'am. Thanks. Sorry about that, Senator Summers and Senator.
Nice to
Huston.
see you.
Nice to see you too. Have a good weekend.
You too.
Senator Summers,
Yes, ma'am.
I think you missed a vote or two.
I did. It was, I think, the second or the last one. Excuse me.
That's the consent calendar.
Heather Summers votes yes.
Thank you. Let me just make sure I have you for everything else.
Excuse me.
You're all set, Senator. Senator
Thank
Haskell.
you.
Thank you. Have a good weekend.
Hi, Beverly. I'm not sure how many I missed. I apologize.
I'm going to check for you. You missed the first one, Senate Bill 213.
Senator Haskell votes yes.
You missed House Bill 5419 concerning DEMA's recommendations regarding regional behavioral health action organizations.
Yes, I'd like to vote yes.
Thank you.
That's all?
No, just 1 minute. Let me just check the consent vote to make sure you're all set. Yes, I think that's all for you.
Wonderful. Thank you so much and have a great weekend.
Same to you. Representative D'Amico.
Yes, Beverly, how are you?
I'm surviving.
Fun times, fun times. I think I missed the very first vote, if I'm not mistaken.
I'm going to make sure I check for you. And you voted on consent. Yep, you did. Okay, D'Amico. You missed the first bill, Senate Bill 213.
Yep. So I would like to be recorded as a yes.
Okay.
I think that's it for me, but
I think you're
I
all-
appreciate that you always double check, Beverly.
Yes, I
thank
always
you.
make sure, else I have to track you down by phone.
There you go. You don't want to do that.
Thank you.
Thank you
Have a
very
great
much.
weekend.
You too. Appreciate it. Thank you.
Yep.
Hi, Beverly.
I'm so sorry.
That's okay. Thank you for being there. It's been one of those days.
I know.
Everything on a Friday.
I don't know how you guys do it.
Well, we don't without your help. Thank you again. And always have to remember we're still being recorded and taped. So thank you.
You're welcome.
I am ready to go.
Okay, item number 1 on the agenda, Senate Bill 213.
Senator Huang votes yes.
Item number 2 on the agenda, House Bill 5190.
Senator Huang votes no.
Item number 3 on the agenda, House Bill 5275.
Senator Huang votes yes.
Item number 6 on the agenda, House Bill 5419.
Senator Huang votes yes.
And 2 bills went on consent. House Bill 5278, that is item number 4, and item number 5, House Bill 5396.
Thank you. Senator Huang votes yes.
Thank you.
Thank you, Madam Administrator, and have a fantastic weekend.
Same to you. Thank
Love the
you.
haircut.
Thanks.
You're welcome. Take care.
Yes, see you on Monday.
What's going on, Bev?
Hi, Representative Scanlon. How are you?
I'm okay. How are you?
I'm well, thank you.
All right,
Would
I'm
you
gonna
like to
pull up,
start
I'm
with
gonna
the?
pull up the agenda here.
Okay.
Okay.
Okay, items 4 and 5 went on consent.
Okay.
Okay. How would you like to vote?
Yes.
Thank you. Item 1,
Yep.
Senate Bill 213. An act allowing medical assistant to administer vaccines. How would you like to vote?
Is that a pretty all over the place vote right now or what?
We have just a few no's.
Are the no's Democrats or Republicans?
Two Democrats.
Okay. I'll vote yes.
Thank you. Item number 2, HIV testing.
Do you know what that bill, can you just give me like a 2-second summary of that? Do you know what that bill does?
I think it requires emergency rooms to do hospital emergency rooms to do an assessment. Let me pull the stuff
I'm looking
up.
at to require physicians should. Okay, I'll vote yes.
Thank you. Item number 3,
Yes.
and item number 6.
Yes.
Thank you.
Okay.
Thanks. Have a great weekend.
Have a good weekend. Bye.
Bye.
Hi. Thank you for letting me know.
So I've got an agenda in front of me right here. Okay, so we got 6 bills here. The first is SB 213, an act allowing medical assistance to administer vaccines.
Do I have to say my name like usual? Okay.
I think
I vote yes.
then we've got HB 5190, an act concerning testing for human immunodeficiency virus.
I vote yes.
Okay. Then HB 5275, an act prohibiting certain health carriers from requiring step therapy for prescription drugs used to treat mental or behavioral health conditions.
I vote yes.
And then item number 6, which is HB 5419, an act concerning the Department of Mental Health and Addiction Services recommendations regarding regional behavioral health action organizations.
I vote yes.
All right, and then that's just the consent calendar.
Oh, the consent calendar. Got it.
That is HB 5278, an act prohibiting an unauthorized intimate examination of a patient who is under deep sedation or anesthesia or unconscious. And HB 5396, an act increasing access to mental health medication.
I vote yes on the consent calendar.
All right, then you're all set. Enjoy your
Wonderful.
weekend.
Thank you, you too. All right, bye.
Bye. Hi, Senator Kushner. How are you?
Hi, how are you?
Very, very
I'm
good.
ready to vote.
Excellent. We've got 6 bills here. Let me just pull up the agenda. So item number 1 is SB 213, an act allowing medical assistants to administer vaccines.
Senator Kushner votes yes.
Very good. HB 5190, an act concerning testing for human immunodeficiency virus.
Senator Kushner votes yes.
Item number 3 is HB 5275, an act prohibiting certain health carriers from requiring step therapy for prescription drugs used to treat mental or behavioral health conditions.
Senator Kushner votes yes.
Item number 6 is HB 5419, an act concerning the Department of Mental Health and Addiction Services recommendations regarding regional behavioral health action organizations.
Senator Kushner votes yes.
All right, and then we have the consent calendar, which is HB 5278, an act prohibiting an unauthorized intimate examination on a patient who is under deep sedation or anesthesia or unconscious, and HB 5396, an act increasing access to mental health medication.
Senator Kushner votes yes.
All right, you're all set. Have a great weekend.
Thank you. You too. Bye-bye.
Bye. Hi, Lisa. How are you?
Hi, good, how are you? I'm on the plane still. I just landed. I'm ready to vote.
All right. 1 second, I'll pull up the agenda. All right. So item number 1 is SB 213, an act allowing medical.
Yes. Yep, I know it. Let's just keep going.
Gotcha. So you vote on that?
Yes, on that.
Great. Then we've got HB 5190.
Yes.
HB 5275.
Which one's that?
That is an act prohibiting certain health carriers from requiring step therapy for prescription
Yes.
drugs.
Yes.
Okay. And then 5419.
Yes.
And 6. And then the consent calendar.
And then what?
And 5396.
Yes.
Okay. You are all set.
Thank you.
Have a great weekend.
Nice weekend.